Welcome, everyone. My name is Giovana Herrera, and I am going to be talking to you guys today a little bit about tongue-tie treatments. The learning goals and objectives for today are to spread awareness of the wide variety of treatment options for ankyloglossia and to emphasize the importance of a consistent treatment plan for ankyloglossia amongst providers, such as the use of lasers. So for our objectives today, we have that by the end of the presentation, you guys will be able to name at least 3 benefits of pre- and post-operative procedures for ankyloglossia. For objective 2, we have the audience will be able to name at least 3 different treatment options for ankyloglossia. And 3, you will be able to name at least 1 advantage and 1 disadvantage of the use of lasers and ankyloglossia treatment. So let's dive in. So before we start, let's just introduce myself a little bit. I am a practicing dental hygienist out of the state of South Carolina. I graduated in 2023 from Greenville Technical College. I love what I do. I am currently actually expanding my knowledge and working towards getting my bachelor's degree in dental hygiene. So here we are. So I just want to show you guys a little bit of pictures. On the bottom right is my wonderful hygiene class. I adore them all. They are going to be my friends forever. And if you're ever thinking about going into hygiene school, it is definitely the best decision. On the left hand side, I have a picture of me and my boyfriend. We've been together for almost 7 years, and he is my number one supporter, especially now that I am taking on going back to school. Now let's dive right in. So, what is ankyloglossia? What is it that we're going to be talking about? So, ankyloglossia comes from the Greek words ankylos, meaning tied, and glossa, meaning tongue. This is a congenital anomaly of the tongue characterized by a short lingual frenulum. This is associated to functional limitations during feeding, swallowing, and articulation and breathing. Now, what we would do in this portion of the class is essentially do something called a turn and talk activity. So I would hand out a couple of pre-assessment questions that are right in front of the screen, and we would essentially answer them to the best of our abilities and talk about it amongst each other. So once we take a couple of minutes with that, we will hop right back in. Now, in this part, we are going to watch just a short video of a tongue tie release surgery. So let's go. All right. I know these images can be a little tummy wrenching, but that child did wonderful at getting that tongue tie release. So beautiful job to those professionals. Now let's keep going. So why is treating ankyloglossia so important? So our tongue helps us with swallowing, ingesting, and digesting food. So if we have issues or an impingement in our tongue musculature and movement, we can have difficulties with speech. We can have difficulties with breastfeeding and bottle feeding in infants. We can have issues breathing and sleep. We can also present issues with malocclusion and also with oral hygiene. So infants usually that have limitations with ankyloglossia, they can have, not have, but they can present also issues down the road if they're not treated properly, such as speech difficulties. And one of the big ones is actually gingival recession. So from that constant movement of that tongue and that frenulum not being released, we can definitely see root exposure on lower anterior teeth whenever our tongue is restricted. Now, what are the treatment options for ankyloglossia? So one of the first ones will be frenotomy, which is essentially the first one that we watched in the video. So it's an incision that cuts the frenulum and releases it. We can also do a frenectomy, where the frenum is completely removed, and we can see that in image on the top right. And also we can do a frenuloplasty, which essentially elongates the frenum. So this one works hand in hand with myofunctional therapy in order to elongate that frenum. So a lot of myofunctional exercises are done to be able to achieve this. Now, how can it be achieved? We can do traditional surgical therapy such as C-plasty, frenuloplasty, and simple frenulotomy, there you go, and also laser therapy. So let's talk a little bit about C-plasty. So C-plasty is a surgical procedure that releases contractile or scar tissue based on a suturing technique that is usually used in plastic surgery. It is pretty challenging to perform under local anesthesia in children, so therefore it is performed usually under general anesthesia or conscious sedation. So this procedure, not the greatest under local anesthesia. Again, patients, they're small. You want to be able to perform this fast and correctly. So with little ones, time is a big factor, and having them be comfortable is also a huge factor. Now, let's say we talk about laser therapy. Laser therapy studies have shown that patients have reported reduced pain compared to those treated with traditional surgical methods, both immediately and after surgery. And that's usually after 1 week of post operation. So that is great results. Another one of the benefits that we can find with laser treatment is that it includes minimal bleeding. It almost creates like a clean surgical field, so there's usually no need for sutures and no really requirement for anti-inflammatory or antibiotic therapy. So laser therapy also is faster. Again, with the little ones, we want to be able to do this quickly and effectively. So lasers are definitely a really good option. Now let's talk a little bit further about lasers. So studies have shown that the use of lasers in ankyloglossia resulted in shorter procedure time, which what I have just mentioned, reduced indications for general anesthesia, reduced administration of post-operative analgesics, fewer sutures or none needed, and reduced post-operative bleeding and improved healing. And although we have wonderful, wonderful advantages, this method also has its limitations. One of them is that it requires really expensive equipment. The personnel that are using this method have to be very well trained. We also need to provide protective equipment for the clinician, for the patient, for the caregiver, for the assistants as well, and essentially anyone in the room. So on top of that, it also does not eliminate the need for myofunctional exercises or maybe even the work with a speech therapist. So, all of the surgical options that we have talked about before, these do not eliminate the need for myofunctional exercises. Now, let's talk a little bit about the types of lasers that we see in dentistry for the surgical removal of ankyloglossia. So we have diode lasers, CO2 lasers, and ER-YAG lasers. Now, the one that we're going to be talking about a little bit more will be diode lasers. So research-wise, it has shown great improvement at tongue mobility and obstructive sleep apnea scores. So patients are breathing better and they're moving their tongue properly. So if we can get proper tongue mobility, we can usually open that airway. And that is mainly in patients, in pediatric patients. The diode laser also offers numerous benefits, including adequate hemostasis, reduced operating time, easier access to the surgical site, precise incision, minimal tissue damage, more effective tissue healing, reduced inflammation, better control of post-operative pain, and greater acceptance and compliance, especially in pediatric patients. Now, what are the advantages of lasers? Like we mentioned, shorter procedural times, reduced use of general local anesthesia, and even suturing, reduced need for administration of analgesics and or anti-inflammatory drugs. We see more favorable post-operative healing, reduction in post-operative bleeding, and complications in the form of inflammation or hematomas. So again, mentioning with lasers, one of the greatest improvements is tongue mobility after using lasers. So when we take away traditional surgical instruments, the hemostatic effect that the laser does, it just creates a cleaner surgery, surgery that has less blood, less movement, less uncomfortable feelings post-operative wise for patients. And this is essentially if we're following a good pre and post-operative treatment plan where the parent and the patient are following a step-by-step protocol given by the clinician performing the surgery. Now let's talk a little bit about the disadvantages of lasers. It is very expensive. It requires very expensive equipment. The clinicians have to be very, very, very well trained. Just because we have a laser, that does not mean that anyone in our office can use it and that it is overall the best treatment option for our patient. We always have to look further. It always will be obviously from a case to case basis, but it does not eliminate the need for myofunctional exercises or the work with a speech therapist. So we have to communicate interprofessionally and communicate with our parents and our caregivers and see what and work together essentially to see what works best for our patient overall. Now, pre and post operative care. There are currently no established regimens for pre and post operative care for children having ankyloglossia surgery. So, this leads to inconsistent recommendations provided by pediatric dentists and other clinicians. So, when we lack those well established protocols and the outcomes that come with it, it contributes to almost a healthcare provider confusion. So it kind of undermines our confidence as professionals and the effectiveness of relying on us for these pre and post operative treatment plans. So it makes it difficult for us healthcare providers to assess the success or the failure of certain pre and post operative protocols. And it really hinders our ability to make decisions about patient care. So, again, communicating and researching a little bit more what has helped for us throughout the years. And now I've been talking more about lasers. Lasers throughout the years have shown to have incredible advantages in the treatment of ankylosing. So let's talk a little bit about preoperative care. So for preoperative care, we can absolutely, of course, talk about myofunctional therapy, wound massages, and breastfeeding sessions. Now, the key with myofunctional therapy, it's that they help re-educate the orofacial musculature. And it also creates a new neuromuscular pattern in our faces. So this helps us improve function such as mastication, deglutition, speech, and breathing. So a combination of good preoperative and postoperative care associated with a good surgical outcome, it definitely improves functional outcomes such as breastfeeding, speech articulation, sleep, tongue mobility, tongue structure. When we see these improvements, we can also see weight gain in patients, wound healing. So I think really one of the big things is also weight gain in these children. If they can't latch properly to mom, they are not getting fed properly and getting the appropriate nutrients that they need to grow. Now let's talk a little bit about post-operative care. So again, myofunctional therapy, that's going to be the number one guy up there. We can also do application of antiseptic gauze or analgesics. This is more for like the C-plasty or the frenuloplasty, where we're cutting a little bit deeper into the tissues and we're not using a laser. We can do wound massages, speech therapy, breastfeeding sessions, oral hygiene recommendations, and dietary recommendations. So with post-operative care, they have multiple objectives, but the key one is to strengthen the musculature. So it also helps us create new muscle movements, increase awareness of all the movements that our tongue and our lips can perform. This will encourage tongue movements related to cleaning the oral cavity, including sweeping of the cheeks, the fronts, the backs of the teeth. So new movements that help us with also just breaking down our food. So it might seem like it's little that with just one tiny piece of skin can help us improve on so many things. Now we can talk a little bit about preoperative exercises. So let's go over a few of these. So we can do the tongue around the world. This one, you move the tongue in a circle along the teeth and you keep the lips closed. You do not move the jaw and you begin with smaller circles around and build to larger circles as the tongue gets stronger. And then you do that about 5 times in each direction. Then we can do lip lickers. You usually just lick your lips in a full circle as you're trying to lick something off that is sticky. And we usually do this around 10 times in each direction. We can also talk about tongue clicks, where you suction the tongue to the roof of their mouth and smile and then click the tongue down. So trying to not move the jaw with this one specifically as well. We can talk about peanut butter scrapes. So you open your mouth wide and you place the tip of the tongue behind the front teeth. You scrape backward as far as possible, forward, then to the throat, then 10 times or twice a day. And then we can do tongue push-ups. Now, post-operative exercise examples. We can talk about the snake exercise. So with this one, you can make a point with your tongue and you extend the pointed tongue out of your mouth and pull it back in. And you make sure that the tip of the tongue does not touch the lip. This you can repeat for about 25 times. Then we can do the waggle flap, which you place the tip of your tongue on your upper and lower lips, move the tip of your tongue up and down, and then you repeat this about 10 times. We can also talk about jawbreaker, even though this one sounds kind of scary, but with your lips closed, you will point the tongue out into the left cheek. Then it should look like a jawbreaker is on the side of your cheek. And then you hold it for 10 seconds and then proceed with the same exercise on the other side. And we can also do the peanut butter rub. This one is also a pre-operative exercise that we can do as well. So this one's just you stick your tongue out and make a point, then you push a spoon against your pointy tongue and you resist that movement. So this helps us with strengthening our musculature overall after frenum surgery. Now, what is the best recommendation, you may ask? So to come up with a perfect treatment plan tailored to our patients and to the best of their interest, we are going to be looking at the timing of when we are moving on with these surgical procedures. The age of the patient, whether the child is an infant or a child from the ages of 1 to 18, because we are looking at their growth patterns. We have to also look at the severity of the ankylosing. And one of the really, really big ones is parental compliance and adherence to treatment recommendations. That is key. If parents and guardians and child, depending on the age, are following and adhering to our recommendations, that will definitely lead to a more successful surgical outcome. And in the long run, we will definitely see improvements in tongue mobility, speech, growth when it comes to these patients. So it comes down to these multiple options. And of course, this will always be based from patient to patient. Not everyone is the same, of course, but again, talking amongst each other and coming up with the best standards, coming up with the best recommendations that have worked in the long run, that have served multiple people. So really just taking some time to dig deeper into the research and see what works best. And overall, just coming up with a treatment plan that will set our patients up for success. Now, at the end of the presentation, we would essentially do something called a brain dump activity, where we would have poster boards and markers, and we are going to dump all the information that we just learned from this presentation, which was a lot, but we are going to name 3 surgical options for treating tongue tie. We will name 1 advantage and 1 disadvantage of the use of lasers for the treatment of tongue tie. And then we will name 2 pre and 2 post-operative recommendations for patients undergoing tongue tie treatment. So we would take about 5-10 minutes just discussing this amongst our peers, and then we would conclude after we are done with that. I would ask any further questions for anyone. And that is the end. Here are my references. And I will be also handing out a form with some questions just to let me know how I did today. I hope you guys enjoyed the presentation and that you learned a bunch. You guys have a great one. Thank you.